Now, something to get our teeth into. It's your chance to call the dentist. The dentist in question is Dr. Sam Jethwa. He's going to be giving us the do's and don'ts of how to care for your teeth and answering your tooth-related questions. So, give us a call, 0207 862 2222. He'll try and help you the best he can. Sam, great to have you here. I think there's probably never been a better time to have a dentist on to talk to people because they are so in need at the moment. The context to this, people struggling to get NHS appointments, feeling like for a lot of people that dentists are financially out of reach for them as well. I mean, it's not a great situation out there, is it?
No, and we've talked about it on the show before. The number of people that are needing a dentist and not being able to reach a dentist is getting out of control, especially when we're talking about NHS dentistry. The availability of it is reducing and the people that need it is increasing, and it's just becoming a time bomb that's just about to go off, really.
I mean, we used to look at DIY dentistry as a joke, as something that was open to satire. I remember Bob Mortimer some years ago filling his own teeth live on air. But that's happening now. That is an option for more and more people. And not only that, it's something that's provided for in a lot of our chemists and pharmacies.
Yeah, I think that it's the last resort. I don't think anyone really goes in with the intention of doing their own dentistry, but if you're at that level of pain or discomfort and can't access and haven't been able to, or live in an area where there's just no availability, what are you going to do?
Do you ever see incidents of DIY dentistry coming to you for like remedial help or care? I mean, because I know it's not going to be. It's only a snapshot survey, but how real and frequent is that?
I think that these things are available. And we've got here. This is a dental first aid kit. So that's been, I think, the local pharmacy. Someone picked that up earlier today. That's the kind of thing that someone might do and then come in afterwards, and they might be on holiday and pick something up and then come in and have it properly done. That's not a bad thing. You know, that's actually a bit of prevention. If you've broken a tooth and you get a temporary repair kit, that's the kind of thing we might see. And I've seen that before. OK, so let's talk about the pros and cons of that, if you like. I mean, presumably you can give yourself immediate relief from something. Is there a legitimate purpose to that? I think we look at these things and think it's being sold in a chemist, it must be okay. Yeah, I think dentistry is complex. Our mouths are complex. Dentists train for 5 years to become a dentist and then train further after that postgraduately to actually be able to deal with complex issues. So it would be silly for any of us to think that we could deal with any of those complex issues at home. I think the main thing is if you can access a dentist and you have something that's happened, then that's your first thing to do, not go to the pharmacy and see what is available and try and do something yourself. Often we'll end up making the situation worse, more complicated to actually deal with in the end. We've seen people stick things back on with super glues and...
I interviewed someone who'd actually done that with a tooth, because it had chipped, so they'd stuck it back on with they were so desperate. And many of these things in chemistry are actually quite expensive and people can't afford them. So it's so much pain, they just try and do anything they can.
I mean,
that's true.
Dawn, you have magnificent teeth, got to say it. Do you ever, I mean, is there anything you could imagine ever needing to do or wanting to do? Are you a friend of the dentist?
I am very, very lucky where I live. I've got a very good dentist. One of the few NHS dentist practices that is still taking on new patients. She's incredibly stressed. She goes home and cries most nights, to be honest with you, with the pressure of her job at the moment. But I am very good. I have been going to the dentist regularly, unlike some people, Matt.
So this is my confession moment.
She's dropped you in it earlier.
Proper, thank you. Thanks for that, Dawn.
You're welcome.
I was building up to that. Sam, this is where I reveal I haven't been to the dentist for about the last 8 years since I had a wisdom tooth removed. Because, touch wood, again, nothing hurts. Nothing's giving me jip, nothing is loose or wonky, no headaches, nothing like that going with it. I think I'm probably like a lot of people at the moment. If I don't need to, I won't go.
When you start to feel pain, when you start to feel something isn't right, that's usually too late. That's how our teeth work. So we have nerves within our teeth, and if there's a hole or a cavity, you might not know about it. It would be underneath or in between the teeth, and it gets bigger and bigger. When you actually feel that you've got a problem, and then you need to find a dentist, and it's an emergency situation, that's what's driving people to doing these DIY dentistry and having all the issues. So if you can get in there and prevent, have x-rays taken, have your teeth thoroughly professionally assessed and cleaned every few months, you're preventing problems. And if we can prevent more problems, then it's going to take pressure off the system, it's going to make sure people have healthier teeth, it's all going to be improved that way.
We're also seeing on social media a lot of people demonstrating how it can be done. You know, on TikTok particularly, there are people showing what look like instructional videos. Have you caught up with some of those? Do they make sense to you?
Yeah, social media is interesting. TikTok especially has got a lot of gimmicky health-related and cosmetic-related things on there. And one of the things I saw recently was mixing lemon juice with bicarbonate of soda to whiten your teeth. So brush it into a paste and then you brush it on your teeth. That's an example of some of the dangerous stuff that's going out there on social media, and people put up the pictures of this is my teeth afterwards. You don't know if the photos are genuine. No. All that's going to do is wear away your natural tooth, and that's very dangerous.
We've put together a little compilation of these.
Okay.
Let's have a quick look.
I pay for the dentist when you can just do it yourself at home. And this car boot cell had all the accessories that a dentist needs.
Day 5 of using teeth whitening strips. Day 6 of using teeth whitening strips. Day 7 of using teeth whitening strips.
A car boot sale, is that where you get your tools for dentistry, Sam, or is there... I don't know.
It seems to be that the way that these videos are coming across is that the dentist is just there using a few tools, sort of playing around. Of course, this is a scientific and a medical situation. You wouldn't think twice about going and having a knee replacement in the car boot cell. You wouldn't do that yourself. You wouldn't amputate your thumb and expect it not to become infected or anything like that. So you just don't consider dentistry a home treatment. You've got to see a professional for it in the same way you would a surgeon.
Teeth whitening strips came up in those clips. We've got some here. Again, what are the possible upsides and the possible risks with these?
So there's some strips here that someone picked up from the pharmacy, which are coconut oil strips, and they're claimed to whiten the teeth. And I was in the green room reading actually some of the reviews of this one, and some of them are pretty positive, some are very negative. But this kind of product is not going to really harm your tooth. It's available in the pharmacy. We in the UK are not allowed to sell products high in hydrogen peroxide or carbamide peroxide, the things that can end up being dangerous in high concentrations. But online, you can buy all sorts of things and you don't know what you're getting. So that's usually the first place people go, is online. So be very careful about that. Okay. These ones, they'll probably do something for some people, but there were a lot of people there that are saying they're doing absolutely nothing, and it's still about £20 for that box, so it's not really that cheap. OK,
we're going to take some calls. First off, Scott's in Greater Manchester. Scott, have you done your own dentistry in the past? Is it something you consider?
Oh, so years and years ago when I was a lot younger, I did try it once, but it wasn't sort of like successful, so it's still... I had to go to the dentist to get it sorted.
OK,
I do have a question.
OK, go ahead.
So what it is my dentist, in January, I went for a filling on one of the bottom of my teeth, and the filling fell out over 7 times. The last one only took an hour, and it fell out yet again. Is my dentist using cheap fillings? I don't know. I just need some guidance on this. Do I need to change my dentist or what? Because it's really getting irritating now that I have to keep going back for this same tooth over and over again.
I think part of this is people are so grateful that they've got a dentist at the moment that they'll possibly put up with more than they would at other times. What do you think?
I think that there's probably something else. Firstly, Scott, it's a shame that your tooth is having this issue again and again, and it must be frustrating because taking a time off to get an appointment is actually an issue for people working as well. So I know that's understandable. I think it sounds to me like there's something else going on with that tooth. If a filling is repeatedly coming out, it means maybe the filling isn't an appropriate solution. Maybe there's something more advanced that you need. You can have something called dental crowns or a dental an onlay for a tooth, which is like a partial crown. And it could be that your tooth needs something like that. So I'd ask your dentist if there's an alternative, because doing the same thing again and again and it failing is obviously you need to look at something else. Often, and this is an area that we look at quite a lot in our practice, is bite. I have an interest in that sort of thing, and it sounds to me, Scott, that there's a heavy bite or force on that tooth. Maybe the shape of the cavity is not all coming together in order to allow a filling to last. So I'd look at an alternative option.
Scott, just a quick question. Have you considered going to another dentist? What's to prevent you getting a second opinion?
Well, this is it. I've got 2 dentists the same distance from there, which is just like 5 or 10 minutes away, both of them. So I'm thinking, do I go back to the old dentist, which I didn't really want to do that. That's why I moved from there, because I wasn't happy with a certain part of the service. And I moved to this one, and I've never had a problem until I've actually been passed over to this dentist because my other dentist left. And since I've actually seen this dentist, he's the one that drilled it, he's the one that filled it, and it just keeps falling out. But I did say to him on the third one, is there an alternative? And he just said, no, I'll put a new filling in. I'll try this different type of filling. And that's all I've seen to like progress with, is going back and just getting a bit of waffle, basically.
I think it sounds like some treatments do end up becoming complicated, and I would say that it sounds like he's trying his best, but maybe broach it one more time and say, look, it's not worked. You've tried the other type. Is there something else now that we can do, or is there someone else in the clinic that's better suited for that sort of more advanced work? Because we do have limitations.
Okay,
as well.
We're going to take another call. Poppy's in London. Hiya, Poppy. How's it going?
Hi, good morning.
Have you got a specific problem that you want to talk to Dr. Sam about?
I do indeed, and hopefully it's something quite simple. So this morning I had an issue where I got up, usual routine, was going to brush my teeth, and I had a mouth full of blood. So I continued to and apologies for anyone that's squeamish, but I was continuing to brush, and just the more I kept brushing, the more blood was coming out of my mouth. So I thought it was potentially something to do with my gums, and potentially just wanted to find out what the potential cause of this could be.
Listen, Poppy, this is exactly the sort of place to ask that question. And I think this is a thing that many of us experience blood occasionally. When's the point when we need to worry about that?
Well, it's interesting. You wouldn't accept any other part of our body bleeding, yet we accept that there's some blood when we brush our teeth. With Poppy, you're quite right. It could be something to do with your gums. Have you ever had that kind of bleeding before?
No, I haven't, and I don't have any fillings. I'm a regular goer to the dentist, and haven't had any big issues with teeth or anything. So that's why it was quite alarming, because I thought, this has never happened to me before.
Have you seen a hygienist recently? Had a good overall clean?
Within the last 3 months, yes.
Sounds like you're doing everything right. I would get it looked at, because blood, when we're brushing, is essentially a sign of inflammation of the gum. What inflammation of the gum means is that there is some plaque or bacteria that's causing the body to send blood cells to the area to actually fight off what that is, because that's the start of what we call gum disease. And you hear about, especially in this study about DIY dentistry, there's loose teeth and things like that. That's often the beginning of that process. So to avoid our teeth getting to that level, we need to reduce that plaque build up around our teeth. And that can either be done, techniques at home. And Poppy, you did the right thing, actually. If you see a bit of bleeding from somewhere, you brush it a little bit more and you might clear out that inflammation. Or it might need some more cleaning with the hygienist, or it to be looked at if it's something else.
Typically, is it easier to get a hygienist appointment than it is a dentist appointment? Just for a checkup to see what might be going on.
Hygienists, one limiting factor is they generally are working on a private basis. So NHS provision for hygienists isn't really a thing that's available on NHS contracts. So there's that barrier. But the best thing is to be able to use the right toothbrushes, the right floss, and do things yourself at home for prevention.
I have a very, very quick question, if you don't mind, Matt. How often do you need to change your toothbrush?
Yeah, it's a great question. And we're all probably guilty of not changing it as often as we should. Yes. I think I'll show you an example. So majority of people still use a manual toothbrush, whether it's all the time or whether it's sometimes, which is interesting because electric toothbrushes are often promoted. But the head on a brush, usually like this one, for example, will last for about 3 months. Now, you can see that's starting to wear away. I brought this in because you can see the bristles starting to kind of change. and that's when you start to know that's not as effective. So you change that. Electric toothbrushes have the whole head you change and you dispose of. This is really fantastic, this one, because it's just this part.
Just change the
that's
head
clever.
on that.
Yeah.
So from a sustainability point of view, because oral health and looking after our teeth and dentistry is a big contributor to actually wastage and things like that. So that's from a company called Tooth Angel, and they just send you a new head.
So
automatically.
just focusing on the basics, the things that we've always done, and make sure we do them well with the right tools, goes a long way towards prevention of needing that appointment.
Yeah. Prevention is what it's all about. And that's really where I feel our dental healthcare, even in terms of the kind of care that's provided, should be going towards. Starting young, getting kids on board with actually looking after their teeth and attending and all of that early, preventing these desperate problems.
Dr. Sam, thank you so much for joining us. I'm sure you
Pleasure.
put a lot of people's minds at rest. Dawn, always wonderful to see you.